Wow, can you guys hear okay in the back? Good. So I'll get us kicked off here. Thank you so much for the kind introduction. I can tell you from my perspective that this is really an honor to be here speaking in front of this group. Andrew and I have been working together for probably close to 5 years right now, 2 of which is with the company Freedman and Koski that Dan was talking about. And a couple of years ago, when I was still in government service, Andrew and I had a lunch, and we were talking a little bit about our experiences so far, and we mentioned that a number of government agencies had kind of reached out to us to see if we could be helpful in implementing their policy. And from that, Andrew kind of started to build a vision for the company about us, for a company that we could start together and try and go to as many government agencies and really advocate for good government processes around cannabis policy. And man, am I glad I did for a couple reasons. One is we've had an opportunity over the last couple of years to work with literally dozens of government agencies and companies that try to help government promote good government practices. And I know there's a couple of people here in the room that we've worked in the past, and that has been absolutely rewarding. And then secondly, it's just been really amazing being able to work with Andrew this last couple of years. He's don't tell him I said this, but he's really brilliant, and he's very, very good at what he does, and I've learned a lot from him. So I guess what I'm trying to say here is if you can find yourself a nerdy, super nerdy policy wonk that looks like he's 15 years old and he wants to go start a business with you, go for it.
That was a great introduction. Thanks, Louis.
You're welcome.
So in our 5 years, this is the first time we've kind of done this Statler and Waldorf routine. And so before we got started, we were like, hey, what if we come up with ways to like gently make fun of each other before it starts? And all we came up with was ways to make fun of me. So didn't have anything going the other way. This is one of our favorite summits. This is the second time this summit has happened. And can we get a round of applause for AHP for putting this together? Honestly, when they went for the second round, from the moment this one ended 2 years ago, we've been talking to them about how they put it together again, because this is the only chance for so much public health talent to come together and help form visions going forward. And we're not paid anything to be here, so we're just actually telling you that this is, if the visioning doesn't happen here, it's not going to happen. And so the tone we want to set today is that there's so much important public health work that has to happen in the world of cannabis legalization over the next couple of years, that we need your help to be the political and policy action that brings it through. We want to give you a lens with which to view how you can actually pursue those actions on both a state and federal level. So when we talk today, it's going to be essentially in 3 parts. First, we're going to talk about where the cannabis discussion is right now on the state-by-state level, how it's generally viewed by the public, and where the public debates are. We're going to talk about where you can see it in the data and what you guys can do to help influence the debate in the right directions. The second thing we're going to talk about is more unresolved parts of state policy issues, the kind of evolution of these state programs that are kind of more ripe because people haven't been quite as set in stone on where it should go, and where we hope, again, you will weigh your voice in on where it should go. And then the third one is going to be the federal landscape, and I will tell you that is changing really, really quickly right now. And so I think there's some pretty scary stuff happening. I think there's some pretty exciting stuff happening, but if we don't start coming together with a vision at a summit like this, it's going to run away from us. And so we're excited to dive deep. Where we decided we would start first is talk about how legalization is being graded. And we like to talk a lot about not how it should be graded or what is the best solution, but really what is going on the ground level. And so when we talk, and again, we've been across the country on this, when we are involved in public conversations, these are the 4 issues that come up: youth use, poison control center calls or emergency room calls, driving while high, and tax revenue. Those are the 4 issues that come up. I will notice, I think, probably talking from your point of view, there's some things missing there that seem really important. There's a whole bunch of public health messages around pregnant and breastfeeding. There's this huge issue of substance abuse. There is a pantheon of drug issues that are not on the screen right now that I will tell you, you have to get them there. This not immediately on the conversation level of where people are starting. These are the 4 issues. And so the very first one, like clockwork, if you walk into a new state, the very first thing they're going to ask you about is youth use and where the debate goes. So the first thing you'll hear is, I'm very concerned about the youth use. And the advocacy community, or the people who are in favor of it, will pretty quickly show data that shows, according to national health surveys, either flatlined use or decreased youth use past 30-day use since legalization implementation in states across the country. By the way, all the data we are using today is from Colorado, only to show, because there's such long-term data and because we're so familiar with it. Again, we're not here to tell you this is right, that there's been a decrease in youth use. We're telling you the perception quickly moves to new places when they're grading how legalization is going, that youth use is considered a bright spot of legalization working. There's a pretty quick gloss over adult use and consumption rates, that there is maybe some talk about 18 to 25-year-olds using more. There's a little less talk about 26 to 34-year-olds, and then people really like to point out that there's been an increase in 65 and older, but it obviously is not the biggest thing in the world to talk about. And what I would say is, I look at that data and there's some questions that come up, right? That's a pretty big last year increase, right? And so are those heavy users? Are there more heavy users? Are heavy users using more heavily? All of those are great questions. I will tell you that the general perception is, hey, we expected all these things to double or triple. And so this is great news. And there is no show here. And so again, just the general perception of where we are with consumption rates is good news on the youth use spectrum, and on adult use, kind of nothing to write home about.
So I guess I didn't realize we weren't getting paid.
Yeah,
I should ask some more questions. I just learned that. So Andrew was talking a little bit about consumption rates. I think largely the public views that data that Andrew was talking about in terms of consumption rates as being pretty positive. But at the same time, the public doesn't really necessarily believe that cannabis legalization is without its harms. In fact, if you look at the slide that's up here right now, you're looking at calls to the Poison Control Center, where we see a pretty steep increase in the number of Poison Control Center calls after legalization in Colorado. And reason why we even bring that up is when the public looks at that, they look at that and they say, yeah, that looks to me like as a result of legalization that there might be a problem there, and they probably look at it as a problem that needs to be resolved, but it's a little bit more nebulous to them in how it's going to be fixed. When we look at it from like a regulator standpoint or a public health standpoint, we look at it and go, wow, there could be lots of problems that are causing this issue, and so we might look at it and say, wow, maybe edibles, we need to take a little closer look at our edibles regulation. Are the labeling requirements right? Do we have the right level of packaging? Should we look at maybe doing on-product markings? And so we look at that, just that one thing, but we also start looking at it and we go, well, what if it also has to do with concentrates? Maybe the potency level in concentrates are so high that we should be worried about that, and let's start putting some regulation to that. In addition to the regulatory side, we might even look at this from a public health perspective and a public education, and we might be thinking, well, with that big of an increase, maybe we're seeing overconsumption by new consumers in the marketplace, or we're concerned about accidental ingestion by children. And so because we look at it much more deeply than the general public, the number of policy solutions that we have could end up being relatively large. And the larger that suite of policy change becomes, the more likely you are to see opposition from a regulated community or people that are proponents of legalization. the other piece I think that's important to keep in mind is even though the public generally sees cannabis as having some potential to be harmful, they see it as being less harmful than alcohol. And this slide right here, from a regulator kind of public health standpoint, can be a really frustrating set of data, because even if it were true that cannabis is safer than alcohol, it can really frustrate some of our work, because that doesn't necessarily equate to, if cannabis is safer than alcohol, then all of the regulations should be more permissive than alcohol. So as part of that, that flawed argument that's out there with respect to cannabis and alcohol, we think, from a public health perspective, that what we should do is like have this big, sweet conglomerate of regulations that we put together, and the public sentiment around it may be strong enough that it's really difficult to get all of that done at one time. And so it might be better to think of it in terms of like, what are the little pieces of that puzzle that we can be effective at pushing over the short run, recognizing the fact that even though this is frustrating, and that the argument around it that we might see from industry is flawed, that they're probably going to win that argument. And when they win that argument, is it trying to just get some small steps forward, or is it trying to advance all that public policy at one time? So this data is FARS data, or fatal accident reporting data. And as you see in this data, you see an increase essentially of drivers involved in fatal accidents testing positive for cannabinoids after the wreck. And when the public looks at this data, they're reminded of a bigger problem, or they're reminded of the persistent problem of impaired driving generally, not just with cannabis, but they're also reminded of it with everything else that falls into that spectrum. And so to a large extent, there's a fair amount of public support for trying to make changes to public policy for DUID. The challenge, though, is, and what often happens is, we see what looks like a problem on this data, and the tendency is to try and just go back for just a little bit. The tendency then is for us to try and craft policy that's focused on, or otherwise perceived by others as really being an attack on legalization, rather than really trying to work on the DUID problem. And Andrew and I, our experience, especially over the last couple of years, would tell us that you could be pro-legalization, or you could be neutral on legalization, and you could still see the DUID data is showing a problem. And so what we say is, even though as like a regulator group or a group of public health professionals that we have here in the room today, we can look at this and say, yeah, well, we've got public support. Let's really try and push the policy that's important to us from a DUID perspective. Or what we could do is we could look at opportunities to actually be able to partner with some of those stakeholders like industry, and come up with solutions that craft the policy in such a way as you're not just looking to attack legalization, you're actually really trying to get to the specific problem, which is the DUID policy. So this is an example here of why you probably don't want to go tit for tat with industry on DUID policy. This essentially is state-by-state data that shows fatalities per 100,000 population or 100 million miles driven. And what you see is a correlation with states like California and Colorado that are both legal, where they're either at or below the national average. And then there's other states that are like Arkansas who do not have permissive cannabis policy, and their average death in both those categories is considerably higher. And so again, with the focus here and the point we're trying to get across here is that when it comes to DUID policy, the policy should be about the problem of DUID, not necessarily trying to make it a part of or a problem with legalization.
And the last thing that people always want to grade cannabis legalization on, and maybe actually the first thing and maybe the only thing, is tax revenue. That is extremely frustrating from our point of view. but it's true, and we should all acknowledge it. And as much as I get up and I say, hey, listen, this makes up for less than 1% of the state budget in Colorado, it's not nearly as often as the newspaper will run a number that says that Colorado made $250 million in tax revenue for marijuana without the following sentence, out of a $36 billion budget. But that, it's a losing battle to try to convince people that government isn't in it for the money. First of all, no one believes you. And second, the scales are just off, and no one knows how to say, oh, that's not a lot of money, because $250 million is a lot of money, and it wasn't there before. The way I think it's really important for public health to weigh in on this debate is everybody wants that money to go to schools, roads, things that cost billions of dollars, multiple $billion to solve. The extra $150 million you might have left over from this fund is not going to make a dent in those kind of problems. Meanwhile, there are very good public health programs that can be pushed with this kind of money that otherwise would not be seeing funding. And so I urge you to really think those through and actually approach your governor's offices, your legislative budget offices during the time where this money is a little bit more up in the air and say, if you put it into education, you're going to be blamed in 2 years because education won't look any different. And everyone's going to assume you mismanaged the money. Meanwhile, if you put it into actual substance abuse programs, we will be able to point to very real progress that has been made that otherwise would not have been made. And so there's a really valid argument. The kind of programs that we were approached to in the governor's office in Colorado from the public health atmosphere, from the public health folks, were always my favorite. Always got top of the billing list when we were going through everything from homelessness solutions to diversion programs that put kids into public health programs earlier rather than later. All of those ended up at the top of our list, and we really did thank them at the end because those were politically a much better way out of the conversation than why haven't you solved our education? Why does my school still not have a gym? So that's the conversation that we're at today. This is evolving on the state level day by day. And so we thought we'd give you what we see as kind of the 4 key issues, not even key issues, 4 issues that we're going to be dealing with over the next couple of years that, again, kind of the sooner this group has a point of view and vision about what to do with them, the more you can be weighing in with where there's going. So I'm going to let Louis handle the first 2, and I'll come in on the last 2.
Yeah, so I'll get started with on-site consumption and special events, and really both these are actually 2 distinctly different challenges because of how they're usually designed. But on-site consumption and special events represent a category of unresolved policy that is very, very difficult to find the right balance. And we see a lot of policy alternatives being advanced on both of these. So just kind of like focusing on the on-site consumption piece of this, some of the challenges you see is for example, where is the product going to come from? We've seen ideas that have suggested that the cannabis should come as a bring your own cannabis style consumption place to having to, on the other end of the spectrum, having to actually have regulated cannabis from the regulated community providing that product. We've also seen concerns advanced about that are things related to like alcohol that we know that are established, not the least of which is being able to determine whether or not you serve to somebody who's actually like physically impaired. I don't know if you guys know this or not. You probably do because you're public health. And alcohol, if you can't serve somebody who is physically impaired, and where there's really good data behind what those signs and symptoms are, they're not as well established on the cannabis side. And so there's opportunities there within that particular unresolved policy for us to really participate in that. And my guess is just as I threw some of those ideas up, you're already starting to think to yourself like, well, yes, of course we would use regulated cannabis, and we probably want to maybe even think about whether or not we want to allow them to smoke cannabis in this consumption area, or if they're just going to be able to use edibles. And so there's a lot of things from a public health perspective that really get invoked when you start talking about on-site consumption and events. And I'll just say a couple quick things about events. Again, comparing it to alcohol regulation, a lot of the ideas that we've seen advanced on cannabis style events are actually far more permissive than what we allow for in a lot of alcohol regulatory frameworks. And so there's always the concern then too that you end up with policy that allows for both cannabis use and alcohol at either the same event or the same place where you're allowing for on-site consumption. And then just a couple comments about delivery. Delivery is really interesting because it's essentially taking the point of sale that's normally at a storefront and extending it to the consumer's front porch, right? And so there's, when you think about that, there's all these concerns that kind of get invoked about how you're going to be able to still continue to keep track of that inventory, what safeguards are going to be in place if there's not video cameras and other safeguards to ensure that this isn't just a shoulder tap to get cannabis to someone who's underage. So again, seeing as how these are both under or unresolved policy issues that are still getting debated, I think we're on our 4th year in a row in Colorado of trying to tackle the on-site consumption issue. There's still the opportunity there for all of us to really be able to participate and help to shape some of that policy.
So this is more of a beg from me than anything. The potency debate is the hardest one when it comes to government. Every other substance in the United States, I think this is really interesting and why cannabis is so different than everything else. Every other substance is guilty until proven innocent. You need to come to the FDA with loads of information. Depending on how you feel about the FDA, they make an informed decision on how this can be used by a user, what a typical user does. There is many protocols in place for making sure that substances are safe before they're being used by the general public. That doesn't exist for cannabis, and mainly it doesn't exist because the federal government wasn't allowed to do anything with cannabis for so long that those frameworks don't exist. And so what we lack for potency is a language to even think about potency. And that is so hard when it comes to government deciding what to do. How do you ban something based on potency if we don't even have any science behind that? We don't know what users generally do. We don't know if greater percentages of potency mean that you get greater amounts of THC in your system, whether or not those are titrated at the same rates. We don't know what the impact on the brain is, if any different. And so we need your help developing potency. There's kind of no two ways about that. Both pushing for the sort of data and research to be inherent in the systems as they move forward in the regulated system, with some signposts that say, if bad data comes up, we have to roll some of these back. I would even suggest thinking through, I know Rhode Island is thinking this through, starting with a kind of go slow mentality of pulling back on some of the more potent cannabis in the system, but really also just an interim framework for us to even think about potency. What is, and again, this is language we're going to be asking from you guys, what is kind of not as risky marijuana? What is more risky marijuana? What is high-risk marijuana? What should be accompanying those in terms of warning labels? What should be kept off the shelves? What should be only sold out in single-use doses? There's a whole bunch of work around potency that has to be a little bit guesswork for right now, that the only people who can do that guesswork is the public health officials. And so that's a little bit of a leap of faith and a little bit of a begging on my part, but this is a really big part of the system that's missing that really does require your input. The last is not nearly as unique to cannabis. It actually is unfortunately something for almost every issue, which is that the detrimental effects of legalization are felt most acutely by poor, low-income neighborhoods, and the economic upside development of cannabis legalization is felt most acutely by affluent, rich neighborhoods. Again, nothing that kind of everything goes through that system. The unique thing about cannabis is since part of the messaging around this has been that it's a response to the war on drugs and is supposed to be in some way reparations for the way these poorer communities were torn apart, it does offer an opportunity for public health officials to come in and really push health equity programs that otherwise wouldn't see the light of day. And so one place where I would urge you to be creative is to really think through what are some of those health equity programs that is like kind of your wildest dream that you could get that passed through the state Senate. Because this might actually be one of those opportunities because they are, everybody kind of has a little bit of egg in the face when they look at the data afterwards and they say, yep, we benefited rich white people and we put all the retail shops in the poor black neighborhoods. And so it's really a place to think through what are some of those kind of more far-reaching health equity programs we can put through. So this is in no way rocket science, but this is what I would say I would hope you guys would walk away on the state level thinking through. One is just what is realistic goal setting for your regulatory systems for what you wish to see in the states, and what is some data that you could force your government to be keeping track of, because that's what's going to set up your debate in 5, 10 years down the road when you say this is what we wanted to accomplish, and have we accomplished it? And all the data you said we didn't have last time when we came forward, now we have the data. So think through what you want to see. Second, and this is a little bit more unique from where Freedman and Koski come from this, but public health officials should be paying more attention to the regulatory technology that's being put in place. Whether it's inventory tracking, point of sale technology, that technology to date is our best data that we have. And regulators are using it on a day-to-day basis to make sure that places are compliant. But public health officials should be asking that data to be able to speak to their systems, to be able to tell you, oh, well, it turns out we are selling concentrates at a massive amount more between the hours of 6 p.m. and 9 p.m. in these low-income neighborhoods. The really helpful information is in there that if you guys are aware of the regulatory technology and the kind of data it's capturing, you can start asking to have access to that data. And the third one bleeds a lot into the second one, which is you should have a data plan. There is this debate, you start off so far behind because the amount you have to prove, again, cannabis is kind of or innocent until proven guilty. The amount you have to prove in order to put on kind of normal amounts of regulation is just not available. And so how do you start collecting that data now in order to make good, reasonable guardrails going forward? So if we were giving this speech 2 months ago, we would be moving to question and answers right now. That this is what you could be seeing in the state level. Here's where we think you could best weigh in. The federal landscape we would just not have talked about very much. Here's all the ways you have to bypass federal agencies in order to have a legal marijuana product on the U.S. level. That's the FDA on the outside, and that's the DOJ on the inside. Those are the two ways that it's illegal, both the Federal Drug and Cosmetic Act, and it's a Schedule I substance.